During these days, we have heard a lot, and I was pleased that even Rao was talking about it, about our being well with you, having a good feeling with your body, and well, we call it well-being, not just even a shirt on. It's our T-shirt. It's a program called Wellbeing. I think I've told that several times already. We can do a lot ourselves in order to improve our health. It's not only the medicine and the doctor. A big part can be with us. We have been talking about food and about, eat well. You have a program which John is bringing out on his MPN journal. But we did that last year on Sunday afternoon or Sunday morning, where we showed Qigong and all these crazy things, etc., which you're doing. And in the last 6 months, Ingrid, also with Judith, they have been working on a program which we're calling a well-being program. It's starting now. We will bring it out now. And this is what she will explain you now.
Well, I think I'm going to talk in Spanish because it's my language and I can defend better. So if you don't mind, you change, you put your... But I'm going to do it in Spanish. No, I'm sorry, I'm not prepared. Oh, I can try, but maybe the information is not going to be 100% what I want to tell, okay? So, as Peter said, for a long time we were seeing that what is health care, what is body care, all this. I'm sorry.
It's been a long time.
It's been a long time with my father.
We've been thinking
that we
along with my
thought that
father
it's very
the importance
important
relating with the
talk about
healthcare
well-being,
and self-care, the
mentally,
physical,
spiritually.
energetic, the spiritual one.
So what we have done is creating this project, well-being project. It started 1 year ago with a session of Qigong and conscious breathing. And this is a proof that we've been doing some time. And we have seen that out of the options that we have given, we have had different patient groups, and it has worked very well. So I wanted to show you these slides. Is it me? Which one of the four? Okay. Okay, why is it like this? No, why? Okay, well, it's not very clear. What should we do? Okay, I'm going to explain in the meanwhile. It's a technical problem. So the thing is, we have created a group of professionals that have been coming with us, and they are going to introduce different activities that are focused on well-being, as I said. And we want to emphasize that every one of us should be conscious about our body, about what's going on, about what happens when someone talks to us and we don't feel well, and that goes to a chain and it makes us feel bad. So let's see if we can solve the thing with the slides. Okay, now can I go through them? Okay. Okay, thank you. Well, so as I said, this is a project that aims to give techniques that are complementary to the diagnosis, so that the secondary effects can be more bearable. How do we do it? Empowering our autonomy, and so that you yourself are the main characters of your well-being. Because well-being is something that's created. It's an habit. It's not something that's given naturally. It is something that we have to work on. We talk about diet, about how we talk to other people, how we wake up in the morning, about us thinking about our day. And this is something that goes in your body and makes you feel bad. When you wake up in the morning and just take a deep breath and thank your day, it is a thing. If you're grateful and you start the day with energy, your energy is going to change. Your day is going to be different. So our aim or our objectives are, well, it is to give tools to manage our own emotional responses, and also giving tools to understand that we've got a story. And this story connects us with our purpose. Even if it sounds crazy, it's like this. Things happen for a reason. So we have to understand why we are in this process. So we try to go with you in this process so that and also to have a combination of techniques that are mental and energetical. So here there is a summary of the objective of this project and what you can be helped with, especially emotionally and mentally. Well, you can manage your emotions like fear, like non-acception, which can lead to an stimulation, neurotransmitter stimulation that makes your serotonin and dopamine regulate. So, for example, if we use the conscious breathing, I really recommend it because it's an amazing tool. It can make you change and it can make you feel less anxious. On a physical level, obviously, stress reduction and anxiety. It can lead your immune system to be less stressed. It can help also your your day. There are a lot of people that cannot go on a marathon. Some of the exercises that you can offer are very good for this. These also can help you to reduce your fatigue and also the modulation of the nervous perception in our central nervous system. And on an energetical level, it can help us have a connection with our heart and body, as I say. Well, all of this makes this program, and I'm going to show you the things that we are offering. The first thing is Qigong, as some of you know, which are very slow movements. This is from a lot of thousands of years ago, and we've got patients that are going to talk about it next. We also have the emotional freedom technique, or tapping. So what we do is tapping, and then you can stimulate. So it's near to acupuncture, but without needles. Then we have conscious breathing, as I mentioned before. This is a very good tool. And then we have the oncology diet, and there are professionals that recommend this because every patient is very different. And we have a collaboration with Carla Not, who was here last year. and with the MPN patients that come from us, she can give a service. I must say that the people that are already going to see Carla have had very good results. So, as I say always, we talk, Carla, about the Mediterranean diet. It's very important. Okay, so then we have the guided meditation. We don't have to be masters in it. This is, for example, when you're brushing your teeth, you have to be connected to yourself, and you can tell yourself pretty words, and you're already doing the meditation. Then we have creative writing, which is a very interesting workshop. We talk, and then through writing, we are freeing a lot of emotions. It has to be done by hand because there are researches that say that when you write by hand, your neurons do something that makes it better. And then we have also Yoga Nidra, which is done laying down through breathing, and it's also coming with different sounds. And then you can also do it sitting down. The evolutionary transfer therapy, it is through numerology, and maybe you're going to be shocked by hearing numerology, but this is a very good tool because it talks about who you are, where you come from, and where you go to. And this kind of therapy is very good because you get to know yourself and you understand you get to get answers for those questions that you make yourself usually. So this is a therapy that we want to share because it helps you know yourself. Then we also have kinesiology, which is a muscular test that you do to yourself. I think it was Franco who told me that we were 600 volts of electricity. So imagine 600 watts of electricity, so our body is. So this is somewhere where your body makes a question and gives you the answer. So we can have answers about something if something's going to be good for our body when eating. Also, we have cardiac coherence and therapeutic touch, which is a mix of visualization, breathing, and conscious breathing, because this is also a very good tool to release yourself from the blocks that you have. And here I'm going to show the professionals that are coming with us. They're all girls. We have Georgina, who does Qigong, Marga, who does yoga, and Hui, who does writing. Esther is doing the numerology, and Susanna the kinesiology. So please, Alex, can you put out us with they're connected here, and we have also two patients. Well, here is Georgina.
Hola, buenas tardes.
Hello, everyone. Well, if you want to introduce yourself.
Hola, mira,
Okay,
yo soy
Georgina.
Georgina, soy instructora de Qigong También
I normally do
soy
Qigong.
terapeuta
I'm also
craneosacral,
a therapeutic in the cranium.
acupuntora
I
y
also do
también soy instructora
acupuncture,
en respiración avanzada.
and I'm also
Eh,
professional in
Todos
advanced
estos
breathing techniques.
conocimientos me
All these
sirven para hacer
knowledges
mis sesiones de
are
Qigong,
really worth it
en las,
to do
en
my
las
Qigong
cuales
sessions, in which
mediante una serie de movimientos, respiración,
I
eh,
improve breathing techniques and movements,
meditaciones
and we also do
y
some
desbloqueos,
meditation
intentas buscar el
and
equilibrio.
unblocking.
No,
We are
no voy a
trying
decir
to
curación
find the
porque eso
balance.
sería muy,
I'm not
muy
gonna say
egocéntrico, sino buscar el
I'm not gonna
equilibrio.
say that we're gonna
¿Vale?
heal. That would be
Intentas
a little
llegar
bit of selfishness from my
a un
part. We
bienestar
are trying to find a balance,
que
to find
no
a
se consigue de un
healthy.
día a otro, sino mediante la
Is you
repetición
don't get
y
it
la
in
práctica.
one day all of a
Y,
sudden. It takes time and practice.
y estoy encantada de estar en
And
este
I'm very
grupo, en
pleased
este
to
proyecto.
participate in this webinar, in this, well, exactly in this project.
Okay, so if you want, Marga, I'm sorry.
Marga, if you want.
I also have a close relative who is sick, so I connect a lot with patients who are in this process. I'm doing restorative yoga, and I would like to talk about these two varieties. Yoga Nidra is the conscious sleep, and we also work unconsciously. We do some visualization, a rotation of consciousness for each part of the body. We also repeat the inverse counting of our breath. We work a lot with our breath, taking this breath to the attention to breath to help us being in the present moment and being conscious. So I find it very helpful to stop and to be present in the right now and here. For restorative yoga, we have a relaxed session. We connect with our breath and a lot of breathing, very kindness, very always connected with the patient, with supports that help us to be in a relaxed state, all very gentle. That's my job. Very glad to do that.
Thank you. And as you said, you're also a patient from a family member. So now, Esther, if you want to talk about your therapy, we cannot hear you. You're on mute.
Can you hear me? Thank you very much for having me here and be part of this project that I believe it's very inspiring. And well, I'm a doctor. I'm a holistic doctor and I'm therapeutic and numerologist. And I'm specialized in self-mastery. I think that numerology is a technique ideal for self-discovery. That it's based in the numeric codes that come with our name and our birth date, and it gives us access to these encrypted parts of our character and helps us to distinguish those things that cohabit inside us that maybe are problematic and affects our endocrine system that is responsible for the balance and the health through the changes that we experience throughout our lives. And also the changes that happens to us in both inside and outside. We all have a structure of our character, and that structure is multiple. We have many characters, and some of them are opposites, and we tend to have so different characters, and sometimes we prioritize some and neglect others, and that it's very tiring to our system, to our adapting system, and that's detrimental, both if we're healthy or not, and especially if we're not, especially in chronic diseases. If we can have access to all this cryptic information, we will release lots of information within us that will help us have more knowledge and know how to act. These are monthly sessions, and it will help us to thrive in our lives.
Very well. Thank you, Esther. Now we're going with Susana.
Hi, good afternoon. First of all, I'm so thankful for this participation, being here, and to explain a little bit what I do right now, because what I am is a compendium of what I have done and mixed together on a puzzle, all the pieces. I come from the health world. I was a doctor, Chinese medicine, and therapy, where I studied kinesiology and homeopathy. And what I saw as a pediatric, that everybody was suffering because of their emotions. And right now in adults, I still see that what unbalanced more a physical body is the emotional part. And as you very well said, what's important is the holistic balance, and that there are a lot of therapies and different ways that we can confront that. And I found that through emotional kinesiology, I created a method that's actually thought for kids, because I always say that everybody learns as a kid, being funny and being easy, and where we are able to, in that same method, learn how to communicate with our body, the language of our body, connect with our emotions, and free all these emotions that are trapped and blocking our body energetically. So what I do right now is, in a very easy way, teach people that want for themselves to be able to do it, or as an individual therapy. I'm also doing that, and I'll be glad that I can help everybody, anybody that comes here with me. Thank you so much.
Thank you, Susana. And now I give the floor to Carla.
Can you hear me? Okay, perfect. So my name is Carla Not. I'm a nutritionist, a clinic nutritionist, specialized in oncology, and we've been collaborating since the pandemic in 2020, and we've had amazing results all over Spain. We've had patients with MF, ET, and PV, and all of them has amazing results. I'm shocked by the results, indeed. And when I started, I was in another cancer treatment, and I've seen amazing results. We've seen lots of advances, and in most patients, all of our patients are very volunteering, and we have spectacular results in their quality of lives, fatigue, everything has improved, and everything we can do to help them, it's great. I'm very grateful to be able to help them.
Thank you so much, Carla. And now Pui, she has the workshops of creative writing, but she's not here. So I want to give the floor to Paloma, who is a patient. So if you want to introduce yourself and tell us how you've been living this.
Good afternoon, everyone. I've been doing chickens some months and just a little time doing yoga with Marga. My experience is being really positive because I have thrombocythemia. But even if it's just thrombocythemia, I have a lot of symptoms like a lot of fatigue. So all the exercises that you are providing me are being really effective. Sometimes just with the intention, I feel like I'm improving so much. The benefits are being really positive. I'm very calm and I'm feeling more energetic when I'm doing the exercise with a student with a continuity. So I really recommend this type of exercises to the patient with these types of diseases, because I've been doing for just a little time and I feel that I'm improving so much. So if you do for a long time, it will be really beneficiary for all of us. So I'm really thankful with you guys for this opportunity. Every day I feel with so much power. I really feel motivated to continue to do the exercise, the breathing exercise. So I'm really thankful with all the instructors and with you guys that you have organized everything for us.
Thank you, Paloma. Congratulations and go on, because Georgina and Marga have told me that you are going very well. So thank you so much. And now I want to give the floor to Leonor. So Leonor, please tell us. You're on mute.
Yeah, now you can hear me, right? I would like to share almost everything that Paloma has just said. Right now, I have myelofibrosis that started in 2012 with essential thrombocythemia. And then I get some complications, an ictus. My access to certain physical activities in these years has been limited. And when I found you, finding Georgina Amarga has helped me first because of how easy it is to do it from home without the need of moving anywhere. And secondly, because the masters adapt it perfectly to our needs and to our possibilities. All of this has been very positive for me. I met you because I first knew MPN Spain, and all the activities and seminars I've assisted have been very fulfilling. In the moment you proposed well-being, it was marvelous for me. So just like Paloma, I have been very present in Qigong and yoga. And apart from the positive impact that I've felt on fatigue and other complications or side effects, I also wanted to talk about the splenomegaly issue. I don't want to say because I'm not sure I can risk it, that it might have improved. I don't really know because I've also had some bad days recently with my spleen. But it's true that every time and the time around Qigong or yoga, it's feeling like the spleen gets relaxed and the body reacts very nice to all these exercises. And that's why I recommend it absolutely. And just like Paloma, I'm also very grateful for the opportunities you give us. I gotta say that I have also participated in the workshops, almost all of them, about creative writing. And cognitively, it has a tremendous positive impact.
Fantastic, Leonor. Thank you so much. So I'm going to give the floor to Bui, who does the workshops of creative writing. Hello, Bui.
Hello, everyone. Can you hear me well? Okay, because I'm on the street and it's a little bit windy. First of all, it's very nice to see you all, Ingrid. It's a pleasure to hear from you and seeing you, Leonor. And yes, I'm the one that that offers the creative writing and narration workshops. And what we do is, apart from having a nice time all together, having company for a while, what we do exactly in the workshop is through writing and reading of what we've just written and different poems and all that stuff. We, as from we transform, we have company to hard times that's linked to the disease. Apart from the life, we do a lot of writing and we try to transform fear, that we are very obsessed with fear. There are some symptoms. I've been diagnosed for 8 years now from ET. And let's say that what I've lived the most is the fear apart from pain and different symptoms, side effects also that they are linked to the disease. I've lived a lot of fear. So my aim is to achieve that there are less and less people that can transform their fear to other energies like mindfulness, yoga, and all that stuff. In my case, I'm doing it through writing, reading, and having company, not being alone. And maybe, as Leonora has just said, maybe somebody that's participating in the workshop, it would be more suitable to speak about this workshop. But if you have any kind of doubt or question, I'm gonna be pleased to answer you all. It's been really worth it for me to write and read during these 8 years, not only writing, but also speaking about it out loud. Not only my life, well, dealing with the conversations that I have with other people, how I have these conversations, what are my limits, how are my conversations with the different hematologists, what's how I communicate, and I think it would be really helpful to other people to deal with this type of healing. Yeah. I don't know, Ingrid, if somebody has any questions or
I don't know because I still have to talk about someone that's here next to me,
okay,
Judith,
perfect.
because Judith is a patient and she is also a user of this project.
Well, I'll introduce myself. Tomorrow I will tell more about my story. I have primary myelofibrosis. I'm 24 years old. My disease got worse and I started taking Pegasus. So the high doses of Pegasus led me to depression and anxiety. And with Ingrid, she had the idea of this project and I started the trial. And it's the example that this truly helps. I started with Susanna and with another therapy called biospirituality, and it has actually changed my life. Before, I was not able to go out of home alone or go partying, and in August, I took a solo trip by car around the north of Spain. And this is all thanks to these therapists and professionals. I have to tell you, Carla, that on Monday I will start the diet because in this event it's hard and it has changed my life. I can go out party all by myself. I can meditate, do yoga, and it has truly changed my life. So I recommend it.
Okay, so honestly, from here, well, we have 3 patients that are being going through this habit, and they're doing one of these workshops weekly. And I wanted to have them here because they have gone through a lot of improvement. So that's why even though we're not a lot, it's okay because we're going to grow and we're going to adapt this project to American timelines and also the English language so that we can share this with the most people possible. It is available for patients and also family members because they also suffer from this on silence. So you're all welcome to come. If you don't like it, you can find something else. There are some tools here. There are people that are going to go with you from the bottom of their hearts. I know them from some time ago. And all of you, thank you so much. Okay, thank you so much to everyone. Well, if you've got any questions, you can ask.
It's another long-term
It's also
project.
a
It's something
long-term
you can't
project,
do fast, but
but within half of a year that we've been essentially working with this. And I've never tried it, to be honest. It's very close to me.
Yeah. This is becoming worse, I will tell you. I will start to talk Swiss to you when we have a problem. So I never tried it. I don't know why, but one day my body will tell me, do it. So probably I was occupied with my knee, so it's probably because I don't do it. But I can see it on her. I can especially see it on Judith. Judith, we know each other for many, many years. Since she finished her studies, when she was in university, we had our first contact, and she made a trial job with us, and then she stayed with us. So we know each other very well. I know all her history, and she has improved tremendously. It's something, she's a new person, thanks to these treatments which she has been making. So I think we all have one of these problems or certain problems. Very often we don't accept it. We simply don't have a value to say that, yes, I do have that problem, and I probably have it also. But you have to convince yourself, and one day you start it. So I suggest try it out, whatever you think is the best for you. And I just wish Ingrid good luck.
Thank you.
I hope she has the same patience as I have, and then you'll be successful.
I think I'm very patient, so no problem.